All right, so welcome to San Diego Miramar College LGBTQ Resources for Students panel, especially focusing on health and health services, including mental health. But we also have a wide range of resources that we'll be presenting today, including community resources. So my esteemed panelists, if you would like to introduce yourselves, starting with Marian.
Hi, I'm Marian Edelbrock, and I work over in the health center, but we're on the mental health side. And one of the amazing things is we've got 3 full-timers there. So the students are very fortunate. Welcome to today's program.
Thanks, Marian. And Elaine?
Hi, good morning. I'm Elaine, and I'm one of the nurse practitioners who works over at the health center. I'm very excited to be here today, and we have great resources, and look forward to sharing them with all of you today.
All right, thanks so much. So I'm going to be going through some resources that were provided by our friend Ali Gonzalez, who is an EOPS counselor. Then we'll move on to slides from Marian, slides from Elaine, and then hopefully about halfway through the presentation, we'll be able to open it up and have more open conversation and allow anyone to ask any questions that they would like to. So we've got lots of different resources that are in these slides, both institutional in terms of the college, community, and other resources as well. Mostly everyone here knows about Club Spectrum, which is the student club, AS student club, of which I am the advisor. And this is a student club focused on building community among students and also sort of outreach and education for our college. You'll learn all about the Student Health Center and about mental health services today, so I won't spend time on there. And then also, as you all know, you can get Safe Zone trained through Miramar College and become a Safe Zone ally, and that training allows you to put a very clear sticker or PDF on your email signature, your syllabus, anything that identifies you personally as a safe zone. And this means a lot to students because they look for these markers. So there are lots of resource centers around. There's one in North County, San Diego County, and then of course there's the Pride organization. And you can find all of these at these links and also on the internet. We will be posting this presentation and then linking to it, so you'll be able to link to get all of these links after the fact as well. And at the bottom of the page, there are some fantastic resources that we've been collaborating with. So for instance, San Diego Black LGBTQ Coalition, we have a representative from that group coming today to talk about intersectionality at 2 p.m. And then there's also the Latinx Coalition, San Diego API Coalition, and Pride also has a group that they call Capimeda, which is a sort of larger pan-Asian, including Indian or what they call Desi individuals who are also welcome in that group. So the Human Rights Campaign, of course, HRC is a place where you can get resources. ACLU, American Civil Liberties Union, has a lot of resources should you find yourself wanting to know more about legal rights. And also Lambda Legal, which specifically deals with LGBTQ legal issues. All right, now I'm going to move on to my colleague, Marian.
Thank you. So this is just the opening slide. We can jump to the next one, please. there's 3 of us working over in the health center and mental health. I'm just one, and we also have Julia, who is a licensed clinical social worker, and Judy, who is a licensed marriage and family therapist, but she's on break right now. So what do we offer over there? It's actually not long-term therapy, it's short-term mental health counseling, but it's free in that you pay a health service fee. So you get up to 6 sessions that are absolutely no cost to you. And there's usually some flexibility as we help you connect with community resources if it looks like you need longer term assistance. And why do we do it? Well, it really can help you along your guided pathway to be successful so that you are really able to focus on your studies, and provides you with coping strategies, helps you when crises come up, which do for everyone all the time. And it gets you to be successful in your academics, which is kind of why we're at Miramar. Well, of course, in a perfect world, I would say just drop by. The health center is right there on campus. But right now we're still in Zoom mode and phone calls. So I was going to say Zoom prison, but it's not quite that bad. So we do telemental health counseling, as it's called. And that means that we can get the paperwork organized so that we know enough about you to really be successful straight away and get you into a Zoom session. Or if you really cannot connect through Zoom, we can always manage phone sessions. The number that's there, the 619-388-7881, is the general number for the health center. And you'll probably see that number several times in several slides today. And that's the important number for connecting. And we actually have a live body during daytime hours in the clinic who answers that phone. If they're not at the desk, it might go to voicemail. But we do have real people picking up the phone at the moment. At the moment, mental health also has something called Wellness Wednesday. And every Wednesday, we have a drop-in support group. So it starts at 2, runs till 3, and we highly encourage anyone to drop by, come and join us. There's a group of people that are getting to know each other really well, and it's great fun. Thursday is a bit different. It's drop-in, as in literally you get a few minutes dropping in. It's just to help with a question you might have. For instance, you might say, I can't find the number for the Pride Center, or some other similar question you might have, or where do I go if I've got this kind of problem? And it's just to get you some resources. We do 2 blogs through mental health. I do a Mindfulness Mondays one, which gets posted to our Canvas shell. And Julia does a Fitness Fridays, which is predominantly on resilience. And again, that gets posted to our shell. They also get sent out to all the faculty, and a lot of them post them on your academic pages, the class pages. We do all sorts of training educational events. There's a good one coming up called, what's it called? Something about no zebras, I think it's called, on safety. And that one should be great. Keep your eyes open for that one coming up. And on our Canvas shell, if you sign up for it, there's all sorts of resources. There's too many to describe. You'll just have to drop by and check it out. Everything in mental health is confidential. And I think that that's one of the key things to remember. The only issues that are not confidential is if you start talking about harm to self, harm to others, or if you appear to be gravely disabled. Otherwise, you come to us and it stays with us. So we can help you with crisis intervention, short-term counseling, referrals to community resources, although there's a lot. You can check back on these slides later because you'll find some amazing referrals here. We often do consultations. I've even had people coming in saying, I'm in psych and I have to do a paper. Can you help me with some resources? I'm happy to do that. We have just all sorts of backgrounds and materials available to you. And I kind of enjoy that work. I've even helped people with their letters for grants or applications, because I have a rather peculiar love of editing as well. So consultation has a breadth to it that can be really amazing. We do some assessments. They're minimal because remember, we're only doing short term. And one sadly that we cannot do for you is ADHD. That has to be done by an outside provider in order to meet DSPS requirements. Addiction is an issue that a lot of people are coming to terms with right now during the pandemic, because it's an easy avenue for stress relief, but it has a very slippery slope. So we're more than happy to help you find resources, or just to talk about other ways of coping other than turning to addictive substances. Mindfulness is a big thing with us right now. We've got a mindfulness room that we can't use, but we are trying to get mindfulness activities out there. And as soon as we're back on campus, then you have to come by and check out our egg chair, where you can sit in the egg chair, have some wonderful music going on, and do a mindfulness meditation. It's so cool. You'll love it. We also have suicide prevention activities on campus and tons of materials. One of the things that I always want people to know is, if you know someone that you're worried about, come and talk to us. We'll get you some materials. We'll show you ways that you can talk and address it. QPR training is often offered during Suicide Prevention Week. Keep your eyes open. It's also wonderful training. We have informal relationships with all sorts of clinics in the community, so we can connect you with resources out there. And two of those amazing ones are Douglas Young, and the other one is, it's called CCS. It's the Center for Community Solutions, and that's predominantly for violence against women. What do we help with? Stress, test anxiety, depression. You can see the list there, and so many, many more issues. So we're a pretty experienced bunch in our careers. It's hard to phase us. So come on in and try and phase us. Here's a few resources that are particularly LGBTQ plus focused, and you will see this one coming up in other slides today. So after this presentation, check back. There's so many resources, but the center in San Diego is absolutely amazing. And there's somebody there on duty staff. There's all sorts of materials that you can upload from their site. I highly recommend that you touch base there. There's many groups that they offer as well, and you can just see a list of some of the ones that are currently on offer. My guess is they're all Zoom. I didn't check to ask, but at the moment, everybody lives in a Zoom world. So I'm assuming at the moment that'll be the same for the center. But you can see the breadth. My guess is also, if there is something that you're dealing with and you reach out to them and say, I don't see this, have you got some resource for it? The center will jump right in there and give you some suggestions. North County is much more useful for people that aren't right downtown. So there's a very good resource center up in North County. And it's, again, similar. It's a very safe place where you can get support. It's very open and accepting. They're very inclusive, and there's no charge. That's the most important thing to remember. The Trevor Project is a slightly different one. It was based on a kid that suicided, and his parents started this project out. This resource is absolutely invaluable if you or you know someone that you love has expressed any kind of suicidal thinking. Just reach out to them. It's 24/7. Again, no charge. You can text as well. And the counselors that work there are trained and very comfortable talking about issues that can be very uncomfortable to share. It Gets Better Project is actually a really fascinating website where you can share your stories. You can take a pledge there. There's all sorts of videos to watch and multiple different resources. Again, after this, when you go back to check on it, jump into their website and see what's there. It's very exciting. Nami is an organization that is across the whole of America. and it's the Alliance for Mental Illness. They have a fact sheet for all sorts of different areas, and they've got wonderful resources for LGBTQ+ as well, about coming out, about relationships, about becoming victimized, which happens all too often, and where to go for treatment. So perhaps you're traveling or you're thinking of living in another state after Miramar. It's a really good idea to set up your resources before you leave or before you go anywhere else. The American Association of Suicidology is a really reputable, well-researched group. And again, their resources are absolutely fabulous. They have all sorts of fact sheets available and a really good resource if you know of somebody who needs some support. You can get all kinds of information from them. If you are finding it too hard to reach out to somebody else, reach out to us, because we can connect you with the resources too. This is a slightly different one. This is a group of Family Acceptance Project Policy Initiative, and it was based on families accepting family members who have they are determining are LGBTQ, or the family member doesn't know how to even tell their family about it. And sometimes families are not the most accepting. So this is a really good group to reach out to if you're trying to connect with your family on issues that are really difficult. So help is available, and it's available 24/7. You can call the Access and Crisis line anytime. There's also texting. You can text as well, but I just want you to be aware that we care enormously about your mental health. And Miramar is very supportive of their students. So at any time, reach out to us, but if it's after hours, know that there are resources to you. And the 888-724-7240 is one of the best numbers to remember and write down somewhere and pass on. I think that's maybe the last. So where to from here? These are our Canvas shells. So check on our Canvas shell down there, mental health. I've got Elaine's one underneath it, but the mental health one there is the one you enroll in, and that will give you access to all these resources and more. Thanks so much. And over to you, Elaine.
Hi, great. Next slide, please. So just wanted to give you an overview of the Student Health Services Center. So Miramar Student Health and Mental Health Counseling Services provides students with the resources to support their physical and mental wellness needs. The services are offered by licensed care providers and include prevention, medical care, emotional support, and counseling services. So we're located on campus in the K2-102 building. Currently, as we're in a remote environment, enrolled students can make a free phone appointment to speak to any one of our licensed care professionals. So we have nurse practitioners, registered nurses, physicians, and mental health counselors on staff. And then I wanted to share with you some of the clinical health services that we can provide. So if you want to make an appointment, if you have a health question or a medical issue you want to discuss with us, we offer assistance with medications and prescriptions if needed. If you're interested in birth control or need an asthma inhaler or any other medications. We also offer vaccinations and TB screening, and can help with laboratory work. So if you need blood work for school or a job or just for your general health and knowledge, we're able to assist with that as well. In addition, we assist with COVID-19 return to class notifications and any general questions you may have. And for further information, feel free to call our health office at any time, as well as look at the information on our Canvas page. So many of our services are provided at an affordable, low cost, but there are a number of free services that are offered. And I wanted to highlight that since we can act as a great resource for you. So, feel free to make an appointment with a nurse practitioner, physician. We offer drive-up vaccination clinics for influenza vaccine. And currently right now we have access to some free MMR vaccine doses and are offering free TB screenings. And if you need different materials, such as if you need condoms or face masks or COVID related products, we might have items for you. So feel free, please reach out to us at any time. And here is just our contact information. And call us to make a telehealth style appointment. Our operating hours are 9 to 3, Monday through Thursday, Friday from 9 to 1. If you leave us a message after hours, we will certainly return your call and connect with you. And as in Marian's presentation, there are the links to our Canvas shells. Now, I also wanted to share some resources. And today is actually the first day in the County of San Diego where individuals 16 and older can register for a COVID vaccine. So we wanted you to know that, for all college students, 211 and the County of San Diego are great resources for health and well-being options. And if you need free COVID testing, if you're interested in getting the COVID vaccine, I highly recommend you register online on the MyTurn website. That's a statewide based website that can help you locate and access the COVID vaccine. And we also wanted to share with you, since it's STD Awareness Month, some STI testing resources. So there's a program called Don't Think No, which provides women 25 and under free home testing for chlamydia and gonorrhea. So you can go onto the website and they'll send you a kit. And if you have questions about the results you receive, feel free to reach out to our office. Another great resource is Good to Go. And they offer services right now to men who have sex with men and or transgendered women participants. And their services are no cost testing. And so please check out their website and services. And the last resource I wanted to share with you is about the low cost STD clinics that are offered in the County of San Diego. And they charge $40 per visit. And I find it very helpful, especially if you aren't a student, just to have these resources available. And you're always welcome at our clinic too. We can help with laboratory work and help you navigate and provide you with the care that is needed. I also wanted to share with you some online resources to help you find an LGBTQIA friendly healthcare provider. GLMA is a national organization that has a provider directory in which you can find healthcare providers which may meet your specific needs. The World Professional Association for Transgender Health also has a provider directory as well and can help you find transgender affirming providers. And the last website I wanted to share with you is about PrEP. So it stands for pre-exposure prophylaxis. And if you're interested in learning about PrEP, which is medication that would help keep you from being HIV negative, there's a great resource there that can find PrEP providers. And I love this website because, there are different pages for women, men, transgender, women. So please check it out if you're interested. Another great website. So one of the questions we receive all the time is about health insurance. And so the health fee gives you access to our center here on campus, but it is not health insurance. So it's really important for all students and individuals to have some sort of health insurance plan in place. So Out to Enroll is a great website who assists with enrolling in health insurance, especially if you are interested in gender affirming care. And right now, until May 15th, you can enroll in insurance if you're uninsured, or you want to change your plan. You can go to healthcare.gov or Covered California, and you can also call our office as well, and we can try to help as best as possible. And the last resources I wanted to share was the Family Health Centers of San Diego. They have a night clinic that with LGBTQ informed providers. They operate from 5 to 9. Many clinics you will find operate in the day hours. And so if you work at night, if you work in the day and you're available at night, that's a great place to go to for services if you need. So as Marian mentioned, the center is a wonderful community resource. They offer a lot of different Zoom groups, need for housing, and if you need healthcare or food resources. I like Marian, highly recommend that you reach out to them and just look at their website. It's just a wealth of information. And, just to go in a little bit more in depth, the center offers healthcare services, and they can help with healthcare enrollment. They offer HIV testing. They have a new drive up HIV testing on Fridays. And so these are some of the services that you can tap into. And I also wanted to talk to you a little bit about housing. So, if you're in a situation where you need emergency housing and you're between the ages of 18 and 24, please reach out to the center. On this slide, there's a phone number. They have a 4-bed emergency housing facility. It's open, 7 nights a week. So I want you to know that this resource is there in any case if you're in a situation where you need shelter. They also have programs to help you find permanent housing and will support you in many different aspects with regards to that. A couple more resources I wanted to share for our military service members and veterans. So the U.S. Department of Veteran Affairs is is great. And many service members and veterans will get their health care at a VA. And each VA has an LGBT veteran care coordinator. So wherever you are in the country, which VA you attend to, look out for, do a search and find the care coordinator, reach out to them. On this slide, I posted the contact information for the individual here at the VA in San Diego, as well as their email address. And another great resource is the Transgender American Veterans Association. They are a group that helps transgendered military veterans and active service duty members. And so if you have any questions navigating the many government forms you might need to fill out to help change your name, or getting transgendered care through the VA system, they are a great resource to tap into. And that's all the resources I'm providing today. There's many, many more resources on our Canvas page. And if you have any questions, feel free to reach out to our office.
Thank you so much, Marian and Elaine, for those amazing resources. That's so much work to compile, and we really greatly appreciate it. For all of you who are on the call, I wanted to let you know that this will be posted in our Miramar College Professional Development YouTube channel. And I can also send a link to the slides to everyone who is here today. So now what we're going to do is open it up to a more general conversation. So we wanted to talk a little bit more about a few issues or topics that are related to both mental health and sort of physical or medical health. And one of those is gender affirming care. So I wonder if you could each talk about, first your understanding of gender affirming care as it applies to your field. And how does your office, or how do you personally think about or help provide, or what kinds of resources might you have for gender affirming care? And Marian, we'll start with you. And you're muted.
So much for pearls of wisdom, right? I think you'll find that all of us are safe zone trained, which I think is one of the first keys in looking for support. And all of us working in this department have had, again, a wealth of experience working with individuals who are questioning all sorts of avenues in their life, and gender affirming care really is just exactly one of those big issues that people are struggling with in life. And you may not even realize that that is exactly the reason that a student is coming into your office. One of the things that we often find is that somebody comes in with a presenting problem that actually has nothing to do with truly what's the underlying issue. And so I just really want to encourage students who are struggling with issues. It could be talking to friends, it could be talking to family, it could be connecting with individuals, it could be questioning even within themselves. Who am I? Being at college is an age where we're always asking that question. And if you add a superimposition of who am I sexually as well, it can feel very overwhelming. So I really want to encourage anyone that is looking for support, come on in, meet with us. You can talk about anything you want. we are open to any issues that come across and through our doors. And I know it's on Zoom at the moment, which, as you can hear from what I've been saying, I find very frustrating because I'm very much more tactile and in person, and I like presence. But Zoom does work, and we do care enormously. So I would just say, bring it on. Come talk about anything. You can't, it's really hard to surprise us, actually. So if you have something that you want to see if you can surprise us with, go for it. But we were there for you. We are absolutely there for you. And any questions, if we don't know answers, we're more than happy to share resources or to help you track down answers too. There are many very skilled therapists in the community who work in the LGBTQ+ area. I've worked coordinating warm handoffs with various community providers. And we have some totally amazing people in San Diego. We're very fortunate. So if what you're dealing with is something, as it often is in psychological questions, something that really needs longer term support, we'll find a good resource for you.
Thank you, Marian. So Elaine, how do you, from your perspective, understand gender affirming care, and how might you approach that with students who come in to see you or someone else at the health center?
Sure. I mean, I just want to echo, what Marian is saying. I'm safe zone trained. We have wonderful other providers who are as well, and we welcome. There's a lot of different aspects from related to medical care, and please feel free to make an appointment to have a conversation, and we can help with certain aspects as far as ensuring that you're in good health, physical exams, maybe laboratory work, different testing you might need. And actually Club Spectrum has a great website with resources and information on this health topic, and definitely they actually have a list of items that you should discuss with your healthcare provider. So you can bring up these questions, and we can I can help with navigating and providing resources to help get you the care that you need. Please just know that it's a safe environment. We're here to help, and definitely help become, just reach out.
Thanks, Elaine. Sometimes I get questions from students about specific things like, can I get testosterone shots from the health center? Can they help me in terms of, providing documentation for gender reassignment, surgery, or things that might be required. Can you address some of those things, and what are the limitations that that we have for our college health services on those kinds of things, or what can we provide? Maybe Elaine, you can start.
Sure. So we as far as that specific question regarding testosterone shots, so we can help with some laboratory testing, or if you have a question about how to give yourself an injection. But because it's a long it's a medication where you need consistent monitoring. It's really important to connect with a healthcare provider and find a primary care provider long term. So we can definitely connect you with different care partners who can provide those monitoring services. But we are able to do provide guidance, you know, maybe some of the initial steps to help you get on your way in regards to that.
Thanks, Marian.
I just wanted to add a little bit. I totally agree with you, Elaine, that finding a provider who can really be there with you long term, and same thing with psychological support. We can help you connect with somebody. We can help you with your initial questioning, your initial self-exploration. This is a long road, and it's hard enough when you aren't questioning your gender to explore adolescence into adulthood, because it's a road that we all have to walk down and find ourselves. If you're also adding your questioning of your gender and how you really want to be in this world, it's really important to care enough about yourself to invest a lot of time into really looking after this area, so that you feel very comfortable with who you are in your skin. And that means that we can help you find the resources, but I highly encourage you to connect with somebody longer term. I think one of the things that a longer term person will be interested in is knowing that you actually have started the ball rolling. And therefore, one of the things that we can provide for you is a note saying, yes, they showed up regularly to discuss the topic that they were wanting to discuss. If you're looking for very specific information for courts, that's not really where we can help you. But if it's connecting you to somebody and showing your commitment and your desire to invest, we can definitely help you and compose some sort of a supportive letter indicating that this is your passion and your quest. And I'm all for supporting everybody exploring who they are and where they're going in life, because it's a challenge.
That's for sure. All right, thank you so much for giving those responses with the a lot to think about there. I'd also like to ask you about self-advocacy and what that might look like for students. So, we often will counsel or encourage a student to be their own advocate, but what does that look like in practice? How can we provide sort of I don't want to say instructions, but what should we encourage students to do who need to be their own or would like to be their own self-advocates in both mental health and their own medical health? Marian, we'll start with you.
It's funny, I listened last night to a film that was called, it's the Greta Thunberg film. Have you seen that? It's a short film available on the internet. This is a girl, well, everyone knows Greta now, thanks to the work that she's done. But she decided that what mattered so much to her mattered enough that she was going to dedicate time to this issue. And I don't know if you do know, but Greta is autistic. And it's really hard for her to do what she has done, because the last thing that she really wants to do is speak out in a world of non-autistic people. I found this film very, very powerful and actually, of course, very saddening, because our world is a mess because of our demands of it. But this is an example of how important it is to find your voice. And you can find your voice in many different ways. And one of the ways that I highly recommend is that you find a group. Spectrum is a very good starting point. And the Alliance is another group at Miramar. But we're just one in a whole vast empire of options for people looking for who they are and finding that voice and finding a friend, finding a support person with whom they can confide. So I think really the clear message I want out there is you're not alone. It may feel like you're alone. We may all feel very alone, but there are people out there who care passionately about you, your voyage through life, helping you find things that give you great happiness and can inspire you to be who you can be. Check out Greta. It was just a wonderful film. And the timing was extraordinary because it showed me what passion can do. Elaine?
No, that's wonderful. I wanted to add that, I think that, knowledge and understanding is really powerful as well. So it's really important that you ask your provider questions. If you don't understand the results that you receive from a lab test, or if there is a test that you want to request, ask. And it's very important that you find a provider that you're comfortable with. We're all individuals, we all have different personalities. And, you can, make appointments with, multiple providers until you find, one that you can partner with. So I really encourage, to Marian's point, checking out Club Spectrum, looking at their resources and find your voice, ask the questions, and we're here to help and try to help answer.
This may sound a bit simplistic, but one of the things I often say is, if something goes wrong with the kitchen sink or with your bathroom sink or something, and you need to get a plumber out and you don't know who to choose, there's a whole range of them out there. But if somebody comes to the house that you just feel is a bit weird, a bit shady, you actually don't have to let them in. You can actually say, I'm so sorry. Everything's fine now. You don't have to meet with, speak to somebody that you're not comfortable with. And Elaine, you're absolutely right. Be selective. Pick somebody for whom you have a resonance, and they just feel comfortable. And maybe you just test out, and maybe you come back. But this is too important. You are too important. So you have to feel okay. And you have to feel safe, and you have to feel like you can trust before it's easy to open.
Thank you. I wanted to let everyone know that we'll have just a few minutes for questions. So if you have any questions, be thinking about what you'd like to ask, either on behalf of students or if you are a student, on your behalf or behalf of a friend. But I also wanted to say that it's okay to say no to a provider, which is something that I think our culture generally doesn't, we don't feel comfortable, because healthcare providers, often we see them as people with a lot of status and a lot of knowledge, and rightly so. But we often don't feel like we can say, I'm not ready to do that, or is there another way? right? And, you know, I think I told you both that our family has recently gone through some medical issues. And at one point, you know, we had to stand up to a provider and say, you know, we're not ready to do this. And they said, oh, okay, well, let me give you some other options. The world didn't end, right? You can always get a second opinion about things, you know, and often if, you know, their first instinct may be something sort of high impact, but if you're not ready to go that way, you might say, hey, maybe we can try something lower impact for a while. And it's, you know, it's not an aerobics class, but you know what I mean? So that's something that I think is important for all of us to remember, right? That, that, you know, you can say, I'm not ready to do that, or, you know, I'd like another option. Great. So just a few minutes left. I wanted to know if anyone else had any questions. You can put them in the chat. You can unmute anything that you might want to know, questions that students have asked you, anything like that. So Elaine or Marian, do you have anything, any last words? Oh, here we go. Laura would like to know. Okay, very good. So there's a couple of questions. One is, are these resources available in a format that would be easily shareable with students? So as I said, I'm going to post this on our professional development YouTube channel. There may be an opportunity for you to post it on the Canvas shells. I don't know if that would be something that might be possible. So we can provide a link to anyone who would like it. We can put a link to this presentation on the Club Spectrum shell, or not shell, sorry, website as well. So the link, I think, would probably be the easiest at this point, but I'm sure that you know, that the Canvas shells also probably have lots of resources as well. Does anyone have any other response to that? Marian, look like you.
Yeah, I would just say that it's overwhelming when you're listening to something like this. It's just a flood of information. So yes, I think putting this to slow down, pause, catch little bits that you want, go back and say, I think I heard something. Yes, I think we should post them on our Canvas shells. Great idea, Laura. Thank you.
And just to let you know, a copy of my presentation is on the health services Canvas shell already. And I'll definitely add some of the other information, like the link to the YouTube video, but great suggestions. And yeah, hopefully you'll be able to share this information easily with your students.
And Leslie brings up a very good point, which is, you know, do we tell students, teachers, or parents about anything that they've come to us for?
No.
Elaine, would you like to start there? Sorry,
No, we don't. But if you are in an emergency situation, or there are certain medical situations where we do need to disclose to different health entities, but no, we do not tell your teachers or parents.
And Marian, I think we already heard from you. Go ahead and you can give the response.
I think Psych is very clear that really it is only danger to self or others. If you have been a victim of sexual violence, if you are a victim of child abuse, and if that perpetrator, and if you're an adult now, but that perpetrator is still able to access youth, then we will explore how to file a report to protect young children who are potential victims as well. So we will do everything within our power to prevent people getting hurt psychologically and physically. And we will try and enlist you in that process. But no, we protect your rights, your confidentiality.
Very well said, Marian.
Wonderful. Well, I want to thank you all so much for all these amazing resources. And for those of you who came today, we had some folks coming in and out as well. So the main thing is now that we have these resources, and they will be in a form where we can provide them to anyone who needs them. So I thank you so much for doing all of that work and providing those resources, and for everything that you do for us and for your students. Have a great day, everyone. And come back and see us again today for more of our terrific events.
And the drag queen thing.
And the drag queen story hour at 7. All right. Thanks, everyone.
Thank you.
Have a good day.